This conference will now be recorded.
Say this is now being recorded, but I hit it. Maybe.
It's actually pretty high. Yeah, it's just Kahoot.
Yeah, if you just tap it. I can't see. Need to go to an eye doctor. All right, should we do classic or teams today? Teams? All right.
These guys are so.
I got one teams, so teams. All right.
All right. Pick your teams. We're not going to make you break up into a certain amount of groups. Just pick your teams, whatever teams you want.
Trying to segregate the city, man.
So just so y'all know, the test tonight is going to be 50 questions. The test on Thursday is only going to be 25, and I had to struggle to get 25 questions out of that one. So this PowerPoint tonight is, I don't know if you figured it out, is very short, just based off of the little pretest that y'all had. So this should be, most of this should be common knowledge. Mainly the only thing that y'all are going to have to focus on is the vital stuff and a little bit of the age gap differences and what those defining points are.
Bad boys. Calvi Walvi.
What's up, Buttercup?
Welcome.
Oh, yeah.
All right, is everyone signed up? Is
I
anyone
don't
still working?
know if Austin's in here.
Austin.
Oh, yeah.
Me, her, and she. I like it.
All right, everybody got a team?
Perfect. No cheating, Calvin. All right, here we go. Which of the following is a charged particle in solution?
They weren't ready.
They weren't ready. It is electrolyte. Good job. How does your body respond to increased CO2 levels in the bloodstream? Nice. So it is increased respiratory rate. So the decreased production of ATP, that's decreased oxygen. So remember your anaerobic and your aerobic metabolism. So the increased respiratory rate, when our CO2 builds up, it builds up in our lungs, and your lungs react by breathing it off. All right, what type of metabolism occurs in the presence of adequate oxygen? Y'all should get this one. We just talked about it. All right, so remember, aerobic has air. Aerobic, air. It has oxygen. You guys gotta be quicker with the button push. What molecule is used by the cell's metabolism for energy? All right, what is this? What is this? It's ATP, right? That is what we use for energy. Uh-oh. Does anybody remember how many ATP are made with aerobic aneurysm? Metabolism? 32. Good job. A lot. What harmful molecule is produced by cells undergoing anaerobic metabolism? Nice. Good job. What fraction of room air is oxygen? Nice. Good job. I heard it, ooh, like we guessed, but guessed right. I like it. Blame the internet. What word indicates delivery of oxygenated blood to the body cells? It is perfusion. Good job. Where's Jade? That's funny. Which of the following does not cause upper airway obstruction? It's not red. So bronchoconstriction, right? So think of the word broncho, right? What does that tell you? In the bronchioles, right? Bronchioles are lower airway. What is the normal tidal volume of an adult? This is tricky because it's really not in your book until chapter 9. We looked it up today. But I did mention it last week. It is 500. So do you remember what page that was? Like 390 something? Yeah, 396, around there. They start talking about the tidal volumes. We touched on it a little bit last week. Normally it's like there's a, what's the word I'm looking for? Formula for it.
So the formula, according to y'all's book, is 5 to 7 mLs per kilogram of ideal body weight.
Mm-hmm.
And so you think about the average ideal body weight of somebody, right? Which is like 70, 80 kilos, right? Just in an umbrella term, right? So when you think about the math, 5 to 7 times around 80, 70 to 80 kilograms, that'll get you right around that 500 mark.
Mm-hmm.
So
Yeah.
that's an easy way to remember that.
What is the normal amount of dead airspace with each breath? This is also in chapter 9. It is 150. Good job. I think your book says 150 to 300, and it's on that same page. Which of the following does not cause disruption of respiratory control?
Think about this, respiratory control. kind of a tricky question.
Tricky. All right. So where does our respiratory control come from?
So,
Our
question:
brain.
what is, when we talk about narcotics and respiratory control, how does that affect your respiratory system? Right. So it causes respiratory depression. Right. So once you overdose, do you any longer have control of your respiratory system? Oh, same thing with strokes, right? So there's actually this thing that that strokes can cause a certain type of breathing whenever they have really bad head bleeds, and it's kind of a gnarly sound that you can hear from stroke patients. Same thing with head injuries, right? You think about where a head injury happens, what it can affect. In an asthma patient, what are they doing? They're still controlling their own breathing, right? They might be breathing a little fast, right, because they're having an asthma attack, but they're still able to control their own systems. So that's kind of a tricky worded question, but that's essentially what they're pushing at.
What are the receptors that sense levels of oxygen and CO2 and stimulate breathing? I almost said stimulate.
So
It's purple. All right, so it is chemoreceptors. So remember our little chemoreceptors, huh? Oh darn. They take little samples of your blood of oxygen and then they tell your body whether it needs to breathe more or not. What term indicates a lack of red blood cells?
too easy.
Yeah, that one's pretty easy. Anemia. Which of the following does not cause a loss of tone in the blood vessels?
Oh yeah, that makes sense.
Okay,
Boom.
so let's talk about this for a second. So, what's another word of loss of tone in the blood vessels? Your blood vessels do what? They dilate. So, vasodilation, right? So, what kind of shock is this going to cause? Not so, it is distributive, right? Because you have the pipes part of the system where you have your pump, your pipes, and then your fluid. Your pipes part's too big. So you have fluid in there. It's just not being squeezed hard enough to where it needs to go. So whenever we're talking about blood infections, that's where you get like the leaky vessels, right? So that's your sepsis. That's like your kind of your distributive shock as well. You have spinal injuries. This causes a distributive shock as well. So you're losing those blood vessels. And then your allergic reaction, same thing. Those vessels are going to dilate whenever you go into anaphylaxis, and that's what causes the low blood pressure. Cocaine use is the opposite, is a vasoconstrictor. So what does that tell you? Constricts the vessels, right? So what is your blood pressure going to do whenever those vessels get constricted? Go up, right? So you're having too much tone with the cocaine. Same thing. What is the normal stroke volume for a heart? For the heart? I think what our book did is it took chapters like 9. Good job. It's 65, 70, right around there.
So what does anybody remember what our book says? I heard y'all talking
It's
about it.
70.
Okay. So I was telling her earlier, and there we were talking about this earlier too. Depending on what book you read is depending on exactly what number you get, right? So we were talking about this earlier with the vital signs. So we pulled up a chart of vital signs, and if you look at the chart that we made and then look at the chart that's in the book, it's different, right? So it just really depends on what. Now, when we're talking about this stuff, there's going to be a gross difference in what you're looking at, right? So 65 is going to be close to 70. If you're seeing them in those ranges, and that's what you're looking for. If this book says 70, I'm sure when these cahoots were built, they were built off another book that says 65. As long as you're in that range, same thing with National Registry. Whenever it comes to take your National Registry test, if it asks for the normal stroke volume and you see 65 or 75, all the rest of these are way off, and that's how it's going to be presented. So just understand, as long as you're in that around that range of the question that or the answer that you're looking for, then that's the answer that you want to pick. So it's frustrating, but medicine's weird and the books are weird and people are weird, so they write all these things a little bit different just to kind of confuse the piss out of you.
Mm-hmm. What formula correctly illustrates cardiac output? Ooh.
Remember I told y'all to remember these formulas?
All right. So cardiac output equals heart rate times stroke volume. So not respiratory rate, right? Because our R stands for respiratory rate. Whenever we're going through these PowerPoints, you guys will get more familiar with like abbreviations of things. Does anyone know what TV is? Tidal volume. Yeah. I think this is SVR, systemic vascular resistance.
Yep.
So I had to think about that one for a second.
Yeah, that one kind of confused you, right? You just see the old SV.
What was that? SVR. Yeah, systemic vascular
So
resistance.
stroke volume times the heart rate is the cardiac output.
Mhm. Which of the following is not found in shock? There is one special. There's a couple specials where this isn't going to be the right answer.
No,
But in general.
I think this is going back to the hypoperfusion thing.
Mm-hmm.
Yeah, not like the freaking
Types of shock.
yeah. Yeah. So what this is talking about is like the hypoperfused state of shock, right? So you'll see an increased heart rate because their body's trying to compensate for something. Same thing with the respiratory rate. Their body's trying to blow stuff off, right? This anxiety right here is going to be patients that are like really septic. And you'll see this out in the field. Patients that are septic and they're in some sort hypoperfused state, right? Whether it's trauma related, whether it's sickly related, whatever that may be, they will have a heightened sense of anxiety, right? They'll have that impending doom feeling. They'll sometimes, like we've had patients that are hypotensive, they're tachycardic, their oxygen sats are low, and they're fighting the piss out of us, right? And it's because their body's in an excited state. And so that's where that anxiety is coming from. And that's what this is kind of pointing towards when it says that anxiety is not the right answer. So, like we said, there's situations where this differs, but that's kind of what that's talking about.
All right. What type of shock is caused from a loss of vascular tone? We just talked about this. All right, so vascular tone. This is talking about the pipes again, right? So there's enough fluid in there, but that tone is their vessels are too dilated. There's enough fluid in there, but there's not enough pressure to get it where it needs to go. This is going to be a distributive shock.
A lot of times with hypovolemic states, these patients will actually start to clamp down and their vessels are trying to keep up with their body. And so their vessels will start to constrict as they lose blood to try to compensate for that blood loss.
I don't know if you guys remember us talking about shunting, but like whenever somebody goes into a shock, unless it is a distributive shock, our bodies are going to try and shunt because it's trying to save itself, right? So it's going to shunt. So it's going to clamp everything peripherally away from the core down and just try and shoot blood into all the vital organs.
This is where your head starts hurting because things get a little bit more word deprived.
Yeah. Which of the following best represents decompensated shock? They're all going to say severe anxiety now.
But like they're anxious.
They're like, they got me last time, not this time. I didn't even see your face. I saw your shiny shoes first, and I was like, 80s here. All right, so falling blood pressure, good. That's that line whenever you hit from the compensated shock to the decompensated shock. That's what defines decompensated shock. Their blood pressure is no longer keeping up. They're no longer compensating. It is now in a decompensated state. What percentage of your body's water is in your bloodstream? I got to remember the little picture.
Well, I know what I'm actually waiting to see what the answer to this one is because that worded weird.
Yeah.
Because it should just be blood.
Intravascular, I think it's. Oh, it's 5
Yeah.
in your bloodstream.
So this right here, and that's why I was waiting on this answer to pop up. So this right here is talking about the entirety of your body. This said bloodstream, and that's where that answer come from, right? And so I like this because I like where your head is because you are right. There is, what is it, 60% of your body is made up of water, right? That's what your book says. That's what the tests say, right? So I like where your head is. Unfortunately, that the wording got you because it was just the bloodstream. Yeah.
I don't like this game.
That's what gets most people in National Registry is the wording of these things.
Which of the following is not a typical mechanism of dehydration? I want to cough right into that thing.
Yeah.
Nice.
So what can this cause actually? Yep. So it can cause your body to go the other way, right? That's where you get those really like fluid overloaded patients. Those people that got the big old wide legs and their body starts seeping water and stuff.
What is diaphoresis? Sweat. It's clammy, sweaty. Yeah, that one can be kind of tough. What kind of giggle was that?
Freaking Calvin.
Last question. What chemical is released with hypersensitivity reactions? Ooh.
You got to be careful with how these things are worded.
Mm-hmm. It is histamine. So it's an allergic reaction, right? So to treat an allergic reaction, you give an antihistamine, which is Benadryl. Well, you can't as an EMT basic, but you know, silly. It's crazy
Beautiful.
to me that y'all can give nitro, but not like Benadryl. That don't make sense.
It's also crazy that, and no offense, that sheriff's department can run around with those little pre-filled Narcans, but y'all can't give it as EMTs.
No, they can.
Well, I'm sorry. Y'all can't draw up Narcan and give it to them, which doesn't really make any sense.
All right, people. Good job. Good job. Where's Jade? Who's in the Where's Jade team? We
It's all the
got
people
3.
back there. Did everybody sign this? Anybody not sign it? Yeah? All right. Beautiful. So that's why I was saying, really watch these questions and how they're worded. That's why, and I know with Kahoots it's a little bit different because everybody's trying to hurry up and press in their little answers and stuff, right? But watch these questions and how they're worded because that's what's going to get you on National Registry. So read the question, read the answers, reread the question. That's how I did it.
A hat.
The EMT prep and medic test and all that stuff is absolutely fantastic. Stop being cheap. Spend the 20 or 40 bucks and use it because it is going to benefit you. I used EMT or EMT testing for my basic, advanced, and paramedic, and I passed all 3 of them first try. So, and I'm absolutely dumb. So
That is a great thing that they pointed out too.
This conference will now be recorded.
right, these questions are meant to trip you up. They're meant to make you feel dumb, and they're meant to challenge you. But if you read them and you sit there and read the questions and then reread the question and then read the answers and reread the question, right? I said that wrong the first time, but if you go through and just double check that question, just make sure you're reading it appropriately. Cross off 2 of those answers immediately, the ones that you're like, yeah, there's no way these are right. Throw them out the door, and then drop it down to those last 2 answers and figure out which one you want to stick with. I mean, you'll understand, and I know it's kind of redundant to harp on this National Registry test, but it's a rough test. It is extremely difficult test, and it's meant to be that way. They have billions of questions in a test pool, so you could take that same test 10 times and not get the same questions twice. So
All right. I think this is the password to the test.
nope, that's wrong password.
What? Close out of it. Oh, wait, hold on.
I texted to you earlier.
You texted it?
Oh no, I didn't. I texted Mike.
Wow.
I was just kidding.
I see how I rate. Oh,
Here you go. It's
hold
same
on. Let me
thing.
stop this recording. Oh, boring.
This conference will now be
Um,
recorded.
But yeah, it's not going to get easier, and these tests are going to challenge you a little bit more. Like I said, I think a big problem that I've heard is like the wording of a lot of this stuff. Understanding the different types of shock and stuff like that is going to be a big part of it. And yeah, we're just gonna we're gonna rock out with it, and y'all are gonna do good. You're just gonna have to really kind of push through on y'all's end to do some studying. So
I think we just got a couple more people.
one,
Uno más.
Hmm?
Uno más.
uno más.
How does everybody feel about the blood pressure thing?
I want to do it more.
Yeah. Yeah, so we'll practice the stuff we're going to leave here. So if you guys just want to pick one up and do them on each other. Yeah, they can be kind of tricky. So once you like finally get in the groove of doing it and getting normal blood pressures, then it kind of makes it easier to hear the harder ones. Does that make sense? So yeah, just practice. Like we always say, the more normal you know or see, the more easily you will be able to recognize abnormal. So do lots of blood pressures, find lots of pulses. That's just how it is.
Yep. Because there's going to come a day where you ain't going to be able to find a pulse, and you're going to quickly realize why when you take that blood pressure. So sweet.
We got one more person.
Oh,
We're just hanging out.
well, I get this party started.
So like Chaz said, next week's test, so it's 25 questions. It's not hard. It's all this stuff. So we're going to try and cover all of it for you. Let me add this.
No, it's all right. We're going to get plenty of practice. So don't stress about the blood pressure thing too much. We're going to get plenty of practice over the next 2 or 3 months. A lot of it's going to happen on Saturday. So
Yeah. This, I think today was just mostly to kind of get you guys in the groove, kind of figure out the idea behind it so y'all can practice. All right. So lifespan development. This is not a very long PowerPoint. I think it's like 22 slides or something. There is a table at the end of this where it says all the vital signs. You guys will get a printout of all that, but if you want to take a picture and start remembering them, I would highly suggest that you start studying like kind of ranges for adolescence and maybe school age, maybe for a test. So anyway.
And we did go out and fill this out based on the book.
Yeah.
So this should be what's in your book.
Yeah.
Not to guarantee you that it's going to be what's in another book, but it's in this book.
Yes. I emailed it to Austin, but I'm going to give you guys the new and updated version because the one that I had was not directly correlated with our book. So I went in and fixed it, and you guys I'll email you a new one. So, all right. So our objectives for today: identify key developmental stages in life, determine techniques to assess patients in different stages of life, and then recognize differences in vitals between patients of all different ages. So here's our little timeline, right? So infancy to birth. Remember, neonates are from birth to 28 days. Then we have our infancy is up to 1 year. Our toddler phase is 12 to 36 months. Preschool is 3 to 5 years. School age is 6 to 12 years. Adolescence is 13 to 18. Early adulthood, 19 to 40. 41 to 60 is middle adulthood, and then 61 years plus is late adulthood. I know that there is a test question referring to, it asks like the age ranges of some of these. So it's good to know for this. So birth to 1 year, some of the physiological things that you're going to see. Obviously this differs because not every baby's the same, but this is kind of a general what we want, what is normal, kind of the mean average, right? So 6.6 to 7.7 pounds or 3.0 to 3.5 kilograms at birth. Does everybody know how to convert pounds to kilograms? It is 2.2. Yeah. So, 2.2 pounds. So every 1 kilogram is 2.2 pounds. So if you have a pound and you divide it by 2.2, that's how many kilograms you're going to have. I will write that down somewhere. The weight doubles by 6 months and triples by 12 months. So they grow very quickly during this stage of their life. Their head is 25% of their body weight. Why is this important to you whenever you're dealing with an infant?
To know that you focus on the head and not others.
Right, their airways, right? Their heads kind of pinch up their airway. You want to be careful because their heads are floppy. So their airway is narrow, short, and easily obstructed. So if you guys remember our little mannequins that we had, our baby mannequins, you want to be a little bit more careful with their heads, right? Because their heads are big. So if you crank them back too far, their airway is too narrow and it'll pinch it off. They are, I'm never going to say this word right, but I'm going to try, obligatory nose breathers. That nose breathing kind of stops around 4 weeks. We have our antibodies. They're passed from the mother to the child during pregnancy and throughout the breastfeeding as well. So some of the infant reflexes, what does this one look like? I know it's kind of hard to tell a picture versus like a real kid. But does anybody know what this reflex is right here? Yeah,
Yep.
Moro. So there's Moro and startle, right? And I learned this today, so I'm going to share it with y'all because I'm not saying it's on this next test, but it's probably, you might see it. The difference between startle and Moro is the startle has like an auditory component to it. So if you like make a loud noise and then they do that, that's the startle reflex. And then the Moro reflex is more of like a physical reaction, like you go to drop the baby and they throw their arms out. I turned it off on accident. Sorry.
I was like, I know we ain't doing this again.
One more technical problem. All right. What about this one in the hand, the palm? Palmer? Yeah, palmar reflex. That one's easy, right? You grab their little hand and they grab your hand back. It's cute. What about this one? You brush the side of their cheek and they kind of turn their head to you. It's your rooting reflex. So the way I remember this one is like, this sounds horrible because it's like comparing babies to pigs, but pigs like to root with their nose and like kind of push towards you. So if you brush, I don't know. That's how I remember it. So y'all do you. All right. And then this one, if you put something in their mouth, they're going to suck. Does anyone know the name of that one? Sucking reflex. That's pretty easy, right? So sleep patterns of an infant. This slide was silly to me because I've taken care of infants before and I feel like they're always different. So I don't know how they could like categorize them into being one thing. But this, per your textbook, they initially sleep 16 to 8 hours throughout the day and night. Right? I knew I was going to hear that. As I was making this, I was like, somebody's going to pipe up and be like, this lie. So that changes 4 to 6 hours during the day and 9 to 10 hours at night. And then by 2 to 4 months, they should sleep through the night. Yeah.
I married an infant.
Excuse me. I do sleep a lot. I like naps.
She like naps.
All right. So we have our little soft spots on these babies, right? So we have two. There's a posterior and the anterior fontanelle. So thinking our anatomic terms, which one's posterior? In the back. Posterior is back, anterior is front. So the posterior one closes in 2 to 3 months. And then the front one, the big one on the top of their head, closes in 9 to 18 months. So this is a really good way to assess a baby for like dehydration or any kind of like head trauma, head injury. If they have any kind of buildup of pressure, you'll see that fontanelle bulge. So another thing to keep in mind is whenever babies get pissed, they cry and a lot of pressure goes up. That can also cause it to bulge. But once they stop crying and it doesn't stop, that's probably a problem. And then we have our little growth plates here. Everyone's heard about those, I'm sure. And we have our physical traits of an infant. So bonding, they have this sense that their needs are going to be met, right? Because our babies can't take care of themselves. So mom and dad, mom or dad, however, whoever, they're going to meet the needs of the infant. So they kind of get this trust and mistrust. So they want an orderly, predictable environment. Subconsciously, that's what keeps them going. So they have this like scaffolding thing where they're talking about learning is like a building block, right? So you learn one thing that's more simple and then you kind of up it and it's a little bit more complex. And then they do have a reaction to their environment. Now we are in the toddler phase, which is 12 to 36 months. Yeah, I was just making sure I put that on there right. 12 to 36 months. So body temperature ranges between 98.6 and 99.6 or 36 to 37 degrees Celsius. They do also gain weight rapidly because they're little babies growing, right? So about 4.4 pounds or 2 kilos per year, and then their body systems start to improve in efficiency. So their little airways, they get a little bit bigger. They start to get more structure to their airways. They're still not to an adult where it's like not easy to clamp off their little airway, right? So you still got to be careful whenever you're assessing or treating a toddler. They're still going to have big heads, right? Because if you watch them walk around, they're like this. So their alveoli increase, and brain is 90% of the adult weight. So this is kind of a graph to show you the brain development in the first 5 years. At birth, it's about 25%. Within 2 years, it gets up to 75%, and then by the time they're a toddler, it's 90. So that's pretty significant growth in a short amount of time. I love this picture. It kind of creeps me out, but I love it. So, yeah, it's the little baby teeth that haven't came in yet. So their immune system, toddlers are more susceptible to illness. They're also usually have a lot more exposure because toddler age, they start getting into like the little schools and they're around friends and stuff like that. So immunity develops through the exposure and vaccination. And then all those primary teeth should come in by 36 months. And they stop having little alien skulls. So psychosocial part of the toddler phase. Toilet training is possible at 12 to 15 months, but is not psychologically possible until 18 to 30 months. I'm not 100% sure what they mean by that, because like psychologically, like they can tell you they can go to the bathroom is what I'm assuming. But yeah. They understand words and their meanings, cause and effect. Usually that toddler phase is whenever you walk in. Not all toddlers are like this, but like you walk in and they're like, Mom, and they like grab onto their parent because that's who they want. And then they also kind of get like this separation anxiety most of the time. But these are good things to kind of keep in mind if you're going on, little kid calls. Because sometimes this can be like a predictive hint that there's something else going on at home. So if you're kind of seeing these things, you can kind of piece things together that, hey, this kid's pretty chill with not being close to mom. It's actually kind of scared of mom. I'm seeing these bruising patterns. Like these are some things that might, indicate that you need to look further into it.
But on the flip side, if you're with somebody of this age, don't be afraid to allow them while you're treating them to hang out with mom.
Yeah.
Right? Like if mom's holding them, you can still do a good assessment on them, show them the blood pressure cuff, show them the stuff you're about to put on them, but let mom kind of hold them because that's like their comfort, right? Or dad, that's like their comfort. So don't be afraid to be like, yeah, like, do you mind holding the baby while I do my little thing real quick? Because that a lot of times that can kind of ease the tension between you and, the toddler in that situation.
Yeah. And like whenever we get further into assessments, we learn about like the head to toe assessment. You walk in and you start at the head and go down. At this age, it's a lot easier if you kind of start at the feet and kind of work your way up because you're building that little trust as you go. If you have mom hold them and you start at the feet, you can feel like a good pulse and then kind of come up. That's also really helpful in this age. Whenever we talk about like delivering oxygen to this age, even younger, it might be easier to do blow by oxygen. So if you have like a mask, you can have mom hold baby and then just put the mask next to their face just because they're a little bit more comfortable with that than some random stranger like shoving a piece of plastic on their nose. Like I wouldn't like that, but. All right, so magic thinking, they all get their little imaginary friends. Language basics. Their body systems obviously continue to develop. This is preschool age. I'm sorry. So preschool age, they start to get their little friend group. What's wrong?
Oh, nothing.
Oh, Peer interaction offers opportunity for learning, making comparisons, and being part of a group. So this kind of all starts around the preschool age, which is, let me go back, 3 to 5 years. All right, so then we have our school age, which is 6 to 12 years. Body temperature ranges. I'm not sure why it's warmer than kids. I don't 100% know. But I do know whenever you're like starting to treat fevers, if they're at 101, it's not a fever. It's not a fever until they're over 103. You kind of want to let them burn that, whatever they got going on, off a little bit before you start aggressively treating it with like Tylenol, stuff like that. Their weight gains about 6.6 pounds per year and 2.4 inches per year, depending on the kid. That also changes. 6 to 12 years, psychosocial. So they kind of get their little decision-making skills. That self-esteem starts to come. It's kind of a reward system whenever they're doing their moral development. So if they get in trouble for doing something, they're probably, hopefully, not going to do it again. And if they're rewarded for good behavior, they will continue to do it, hopefully. I say this as like a very broad statement because I know it's not like that for some kids. So. Then we have our adolescence, which is 13 to 18 years. There is a rapid growth spurt that happens. Then you have like your puberty, your maturity. Do you guys remember signs of puberty for in males? Like if you're doing CPR? Huh? Yeah. Armpit hair. And then for females? Yep. Why? He said breast growth. Why is that important to know? What class did you guys take a few weeks ago, or a week ago, 2 weeks ago? CPR. Yeah. All right. So this is kind of where that independence comes in. Everybody, I'm sure, has been around a 13 to 18-year-old at some point in their life. They are very independent. One thing I will say, if you're ever assessing these patients, kind of read the room a little bit whenever you walk in. If mom and teenager are not getting along, maybe kind of separate them from their mom for a second. That's okay. I'm not saying that like the mom can't ride with you to the hospital, but if you just give yourself about 5-10 minutes where you separate them and kind of see what's going on. Also because they want that personal space whenever you're asking them certain questions, because right around here is about the time that they get the sexual maturity, right? So if you have to ask a girl, hey, are you pregnant, or is there any chance you could be pregnant? It's going to be awkward with mom sitting right there. So we have our 19 to 40 years old. I like how it shows them running in the desert. But lifelong habits are formed right around this age. Job and family stress is high. A lot of times people around this age are like trying to find themselves. You still kind of have some qualities of the teenagers that kind of bleed over into this age. And then another thing that's important to know is the accidents are the leading cause of death. So in this age, you're more prone to, not making the best decisions and drinking and driving, or driving erratically because it's fun and everybody wants to impress their friends. So yeah.
Until we show up and cut all your clothes off, and then it's not fun no more.
Yeah. Nobody wants to be trauma naked on a highway.
No.
Middle adulthood is 41 to 60 years. This is your vital signs. Whenever we get to our table, the vital signs are going to be pretty much all the same once you get past like your adolescence. But one thing to keep in mind as you're taking vitals on the elderly population or older, like as they're getting older, is to kind of ask them what their normal is. Because this day and age, we're seeing younger and younger people having more problems that we're seeing in the older generations a long time ago. So
a big thing to note too when you're looking at these elderly patients or this older group of patients. Somebody in this older group might not present sick like, others because of those medications they take, right? So if they're on something like a beta blocker, they're not going to have those increases in heart rate and stuff, right? So if you get there and they smell like a UTI and they're probably septic, you might not see their heart rate shooting up through the sky because of the medications that they're on. So just because you see a normal heart rate, like she said, good history taking and assessments will show you, well, their heart rate's not 140 because they're on this beta blocker. They're still sick. So be mindful of that stuff too.
Yeah. Treat your patient, not your monitor. That's a big one. This age, 41 to 60, is when weight control becomes more difficult. Our metabolisms slow down, so it's more difficult to stay in that like happy, healthy weight that you want to be. And then menopause may begin for women. So premenopause, menopause. Task orientation increases. Empty nest syndrome is very common because all the kids are growing up and starting to leave the house. And then there's also a heightened concern for their adult children and their elderly parents. So they're kind of in this where they're like, my kid's 20 and they're causing a ruckus, but then my mom's 90 and she's about to die. Like there's just a lot of things. So your late adulthood, same kind of thing. Make sure you're doing a good patient assessment and history taking whenever it comes to like 61 or plus age. Just because those vital signs can differ. They might have a normal that's normal for them, but it's abnormal because your textbook said so. If there's anything that I've learned in this field is that our patients don't like to read our textbooks, so they don't usually show up like our textbooks. So make sure you're doing that good assessment. You're getting good history. The cardiovascular system is less efficient and the blood volume decreases. You'll see once they get past a certain age that they love to keep their houses at like 90 degrees. Like you'll walk into like an 80-something-year-old's house and their house is blistering hot because they can't temperature control, regulate very well either. Their cardiovascular system, so things like arteriosclerosis, atherosclerosis, their veins harden, they get more plaque, depending on how well they took care of themselves when they were younger. And then we have our late adulthood. So faces many challenges. A lot of times they're kind of scared of like, oh, one good fall is going to put me in a nursing home. So those are concerns that this age group has. The age group, that's a new one.
Mm-hmm.
Suicide, very common in late adulthood. They kind of get past this middle adulthood stage. They've done their midlife crisis. They're gonna, they feel like they don't have a lot to live for. Their friends are dead, and so they feel like they should die too, which is sad. All right, so this is that vitals chart I was telling y'all about. I think it's a really good idea for y'all to look over the adolescents and like the school age vitals and keep them in mind. One thing I will say is per your book, and you can Google this and get 100 different answers, but per your book, this systolic blood pressure is going to be this formula right here.
Does everybody understand that formula? So what this is saying, right? So we're going to make this easy. 90 plus age in years times 2. So if I have a 4-year-old, what should their systolic blood pressure be? 98, right? So 4 times 2 plus 90. I understand that's freaking aggravating. Trust me, I wish that I could teach y'all a way that this was easier and just give you the numbers, but this book wants to do it like this, so this is how we're going to do it. 90 plus your age times 2, right? So if I have a 12-year-old, what should their systolic blood pressure be? 114. Yep, 114, right? So your age times 2 plus 90. Yeah.
Like I know 12-year-olds that are bigger than 30-year-old men.
Yeah.
Mhm.
Should they still have that low of a blood pressure?
So this is just like a mean. So this is just like ideal, kind of like the ideal body weight type thing, right? So this is what they would consider a normal growth, 12-year-old or 14-year-old, not Jenny's kids, but like normal kids,
Not
right?
my neck.
Yeah,
Yeah, I met
not
Jenny's
Jenny's
kid. I was like,
kids, freaking
hey.
this tall, right?
Yeah.
Yeah.
Mhm.
And so like just, your normal little 12-year-old, standing by yay high, running around kind of doing their thing. This is what this looks at. One thing to note about this that I always like to pay attention to, and I like to tell other people to pay attention to, what time is it?
6:30, 50. Sorry.
So if you watch these vital signs, you'll kind of see a shift here, right? So if you look at their systolic blood pressure, what is it constantly doing as they grow? It goes up, right? Their pulse rate, it's going down, right? Their respiratory rate, going down. So be mindful of that too, right? So their systolic blood pressure is going to constantly go up. Their pulse rate and respiratory rate as they get older should start slowing down. So I like to just pay attention to that because, as you kind of get into like this middle age, if they start asking questions about this stuff, just kind of remember, the younger ones have lower blood pressures and higher heart rates, and then they kind of flop as they get older.
Mhm.
And the older people have higher blood pressures and lower heart rates. So
And when you do that formula and you're like, oh, but their blood pressure is not 98 systolic, as long as you're within that realm, it doesn't have to be perfectly 98. Obviously, it's kind of giving you a general idea of where it should be. And then another thing, this mean arterial pressure, there is a formula for that. I know so many formulas. So sorry. There is a formula for that. So this gets really important because it's telling us whether their organs are perfused or not. So to get this number, there's another formula, which I'm going to give it to you guys on a piece of paper. We're going to go more into a deep dive with like this stuff. This pretty much gives you like a systolic average. The diastolic, some people don't feel like it's as important because they're just like, oh, it's a diastolic number. But I kind of have a soapbox about it, so we will touch on that more. The diastolic number is important. And then this mean arterial pressure, it's not so much in your book, but I did want you guys to kind of start having some exposure to it because those numbers are very important. So another thing is our automatic blood pressure cuffs. They don't take like a true systolic and diastolic blood pressure. They take a map and then they kind of throw numbers out there for systolic and diastolic. So whenever you're taking the automatic blood pressure automatic blood pressures, I'm telling you, I have multiple small strokes. It's fine. You're actually going to look at this number. So it's important to know.
And as medicine's evolving now, like she said, we're getting further away from worrying about this number and more concerned with this number, right? So like she said, we'll dive more off into that, but this is going away more and more in the emergency setting, and we're focusing more on this.
Mhm.
So just keep
For
that
the
in mind
purpose
for
of
later
this
down.
test, from here over is what's going to be important on this test. This
Yep.
test that's coming up.
But
But
real
I
world
wanted you guys to see
information,
it.
we'll teach y'all about this later.
It wasn't very clear what you were pointing to.
Oh, I'm sorry.
Oh, I'm sorry. The mean arterial pressure.
Or
Sorry.
the map. Yeah.
I forget that Austin can't see our little fingers running
Yeah.
around this board.
Sorry, Austin. So respiratory rate, pulse rate, blood pressure, age group is what's going to be important for this test.
Yep. We'll go into depth about the mean arterial pressure a little bit later.
Mm-hmm. Perfect. What questions do you have? No questions. Perfect. I think that's it.
I had a question on chapter 9. I don't know if that's
Okay.
what we're talking about, but
They all kind of relate. I've noticed. I was telling somebody earlier, like as I'm doing these PowerPoints, like I'm looking at chapter 9 and 10, and then I'm actually working on chapter like 19, and it's all the same stuff.
yeah,
So
it's more of a review.
yeah.
So iGels were in there?
Yeah.
Is that a local protocol we can? No?
No, so iGel's not in a EMT basic scope. They're teaching you a lot of things. They're teaching. they're teaching you a lot of things that are like
The only airway stuff
advanced
y'all can
skills,
do,
just so you can see
that's
them,
it.
see what
Basic
they
is
are,
the
see how they
NPAs and
work.
OPAs.
So whenever you are in the field, you can be like, oh, I know that, you know, my provider that I'm working with might need this. So like they have a whole section in there about how to set up IVs, and you guys can't do IVs either. Yeah. So iGels, King Visions, any kind of supraglottic airway y'all can't do. You can just do the NPAs and the OPAs. I know, which is so silly to me because it's the easiest thing. You literally just like shove it in there. Like it's so easy. But there are some states, Idaho had, where you could get like an advanced module. So you just went in and took the test part, like the practical test part of the iGel, and then they would let you do them as an EMT basic. Nevada is not one of those states, unfortunately. But yeah, go get your advanced. We're putting on class.
Just get it done. And then to help out for
Yeah, well, not even that. Like you, like listen. They teach you how to listen for lung sounds, how to set up for the ET tube, how to make sure that it's like in the correct placement, what things they might need. You don't really even have to hold the head because they hold the head. So I mean, unless it's like a trauma situation, then you might have to hold their head for them. But yeah, it's really. I honestly truly believe in my soul that they should just combine EMT basic and A and just make it one thing. Because like you teach an A class and it's all the same stuff, just a little bit more. So, but here we are. Well, we'll bring in iGels though and let y'all play with them because they're cool.
They said they're about to like run inside the ambulance trying to start. Run farther back. Let's get backing up.
Oh, I couldn't even imagine. That would be so scary.
I think there's still gifts somewhere. Hold on, excuse me. Did everybody get all their stuff that they needed? Cool. This wasn't anybody's, right? I don't think he heard me. I don't talk loud enough. I got to get my voice to project more. Oh, thanks. Y'all don't like red? That's it's fine. It's fine. Well, win the Cahoots and you'll get a red shirt.
Maybe. See if you can find it. Oh,
I don't know if they're.
I got time to sit there and read it. I can do it all day. Then you need to get up, walk around a little break before we do the coots.
maybe.
Maybe.
Might do cahoots.
Yeah. We gotta find it.
So one thing that that you can find out real quick by asking people that have taken these EMT basic classes is this one that we're doing is going a lot more in depth than your average EMT class. There's a lot of information that we're passing off to y'all that apparently a lot of people didn't get in their EMT class. Mine doesn't count because I went to a backwoods, like under tree EMT class. A little sketchy. I was kind of wondering if they were even going to let me take my national registry by the time we were done. But there is a lot of great information in here. We're going to teach you all about ways at some point to help in the back of the ambulance, even with stuff that you can't do, such as like setting up IV administration sets, you know, and kind of going through like setup processes of, you know, stuff if you're riding with a paramedic that can kind of make life easier for you and them. So y'all are really going to dive off into a lot of stuff. That's going to be great information for y'all to have. So it's not just bland and boring. And which one is this?
Where did it go?
Oh no, it ran away.
No.
No?
Oh, here it is. So I found a random one. So we'll see.
Lifespan development.
Yeah. So we'll see how good it is.
This isn't our normal guy.
This isn't our normal dude.
This is not our normal guy. So go ahead and hop in.
Is it 20 questions? Is that what it said?
No, I mean, I don't.
We have 3 gifts. So whoever wins can choose between 3 things. So I don't know if you want to do groups of 3 or
What y'all want to do?
do individual.
Y'all want to do
Probably
individual
like a
stuff,
tiny
or y'all want to do? I think that's a reach.
Oh, it's medics.
Oh,
Headaches, Air One. This is what's up for grabs.
Mike picked out of the bottom of the barrel.
We'll get cooler gifts. I'm going to Elko tomorrow, so.
So y'all pick. You can pick in. You can go in groups. You can go by yourself.
Is it empty?
It's up to y'all.
That'd be Chaz.
You want an empty zinc can?
We have an empty Zim can up for grabs. It's already been scanned though. Sorry. We've already gotten Zen rewards. Yeah. Yeah. To our smoker?
Yeah.
Ooh, we got a ways.
Are we doing the?
We did the math. It's gonna take about a year. Yeah. It's like 11,000 points, and you're only allowed to get so many points a month, and we're at like 3,700 right now.
If you come in tomorrow, I got 2 on my desk.
All right, cool.
We got 2 at the house too. 3 at the house.
Oh yeah. All right, is everybody in here? No. The A's, is that Austin?
No, that's me.
Okay. Oh, okay. Got it. Let's see. I'm looking for an Austin.
I don't think it's really fair to give out reach stuff, so we might just bring some more hats or something next week.
Yeah. Well, I'm going to Elko tomorrow, so I can probably pick up some cool stuff. As cool stuff that Elko can have, right?
All right, everybody ready? Everybody good? Ready? Let's party.
It does say EMT, so hopefully it's all in the same realm.
Yeah. Can't make any promises.
Ah.
Oh, sorry, sir.
Give you all a hint, it's more than 20%. It is 50. Good job. 50 seems like a lot, for sure. Diastolic blood pressure tends to blank with age. That's a weird worded question. Oh, what's going on with the picture here?
Yeah, it's like freaking puzzling.
Oh,
They're taking a blood pressure.
somebody spent a lot of time on this Kahoot. Because the one I made, it took me like 2 hours, and it didn't have all this. All right, so the answer is increase, right? So those vessels start to harden, it goes up, blood pressure tends to go up.
Remember what I said? Heart rate, respiratory rate go down, blood pressure goes up.
The penguin has it.
Hey, man.
Work, family, and stress best describe the life stage known as. Oh, this is a good one. Hopefully it's the same thing as my PowerPoint.
Yeah.
If it's based on the same book, it should be. Early adulthood.
No, so this right here is when all the guys buy Corvettes, right? And start trying to ride motorcycles for the first time in their life. Midlife crisis.
Yeah, early adulthood. You think about it, you graduate high school, find the love of your life, get married, that kind of stuff.
Everybody's starting to start families in their 20s.
Into what age range do toddlers and preschoolers fit? Ooh, that's a good one.
Toddlers and preschoolers.
Toddlers and preschoolers.
That's another possible book question.
Yeah, it depends on which book it's coming from, right?
Again, we cannot promise that this Cahoots is going to be fantastic.
1 to 6 years.
I like it.
So that should correlate. I'm pretty sure that correlates with ours. Does it not correlate with ours? preschool,
Toddlers?
toddlers and preschoolers, not infants. Infants would be 0 to 5.
So it's more 2 to.
I can agree with
Somebody,
the 2 to
somebody
8.
open up their book and see what their book says. You make this. We
I
can,
could look right here.
like I said, these freaking books.
Well, if it's dependent on like another book, it's gonna be different. Is it
Hmm?
3 to 5?
Is that preschoolers? What's right before that? So 12 to 36 months is what? Toddlers. So in your book it says 12 to 36 months is toddlers, and preschoolers is what? 3 to 5. So we're a year off.
All right, cool. We confirmed. Ours says 12 to 36, and then 3 to 5.
Yeah.
Among older adults, blank function in the 5 years preceding death is presumed to decline.
Oh, that was a good one.
Yeah. So also an oddly worded question. Libido.
All of them.
Well, that's not fair if it's not one thing.
Huh?
What is the most correct?
Yeah, what is the most correct, right?
This is National Registry. Which one is the most correct?
Because they just told us that the kidney function was
Yeah.
50%. And this does. All right, mental.
Which organ manipulates all of the previous answers?
Calvin cheated. Neurosurgeon over here. Children who make decisions based on their conscience are using what type of reasoning?
I don't even think we talked about that.
Mm-mm.
No, we did. There's a section.
Did we?
I don't think we broke it down this far either. We did kind of mention this, but not so much the term for it.
Pretty sure I know the answer.
I think so too. I was wrong.
I was also wrong.
I was going to guess pre-conventional.
I'm glad. Yeah, I wasn't. I was going to guess psychosocial.
Post-conventional. Huh.
Nobody got that right.
Not a single person. We're about done with this.
Yeah, I'm about done with it too. All right, true or false? Toddlers should have a pulse rate between 90 and 150.
Again, this is purely dependent on your book.
Yeah. Let's see what this thing says. Cause...
Our handy dandy little badge monkey.
All right. My badge buddies said that was false.
So, I really want to. Yeah, my badge bunny says it's false too. What did y'all's book say? Did anybody take a picture of the little thing? Huh?
80 to 140.
All right.
Yeah. So remember what I was talking about earlier. This isn't pertaining to this particular thing because this is kind of a pain in the butt. But just remember, try to find something really close whenever you're on the multiple choice questions, right? So it depends on what book you read. And I really don't like saying that because it makes me feel like I'm teaching or we're teaching you something that's not correct. But this book and the next book are all different. And it's really frustrating.
And you've all learned that cheat sheets are cool.
Yeah, these are neat.
You're not cheating, you're not trying hard enough.
I'm about done with this thing.
I'm about done with it too.
These questions are dumb.
Yeah.
I don't feel like we're getting anything
Robert.
out of this.
Yeah. All right. Does anybody feel like this is benefiting
Which one of y'all
them
picked
at all?
true? Who putting grandma in a nursing home?
Get her right.
Rude.
Does anybody feel like they're
I bet
getting
it was this
anything
one.
from this? No. Okay. Yeah, I'm done with it. So, yeah. How do I exit this?
Yeah, this thing kind of sucks.
All right. So, a couple things that did remind me when CJ said the cheating things are cool. If you guys look for like these little badge buddy things and you want to carry them with you, if you're riding with me, I have no No bad feelings if I'm like, hey, what's a normal, heart rate for whatever? If we go on a kid and you pull out one of these, I'm not going to look at you any different. I do it all the time. So it is good to kind of memorize and get the realms right. But if you guys have a way of looking up stuff and you don't know what it is right there on the spot, and someone asks you a question, be like, I'll find out and get back to you. That's my favorite answer. So besides, I don't know, because I love the answer.
So if you go on Amazon and look up EMS badge buddies, yeah. So there's ones like this that have a breakdown of normal respiratory rates, normal blood pressures, normal heart rates, stuff like that, right? So there's ones like these. Y'all won't use this one specifically because this is for reading EKGs. And then this one is for different parts of the heart and identifying different heart attacks, right? So not a big thing for y'all. Same thing. This one's heart. This one right here is not a bad idea to get. This one is a 12 lead badge buddy. Badge bunny.
It's funny.
Freaking cops. But this one is a 12 lead one. It talks about 12 lead placement, where to appropriately put 12 lead stickers at, as well as goes over posterior and right sided 12 leads. We'll talk about that at some point, and we're not going to deep dive off into it because we don't want to scramble your brain with a bunch of information that you don't really need. But we will go over some of it. Because if we start deep diving into 12 leads, you will all bang your head into the table because I bang my head into the table all the time talking about it, especially with this one because she's a cardiologist. This is pretty cool too. I know this really isn't going to super apply for y'all. This is a guy named Dr. Antevi. He makes this little guide on how to, essentially he taught his 4-year-old how to run a cardiac arrest. And he did it using a guide like this that goes off the ideal body weight, using your hand. So it's like 1, 3, 5, 7, 9, 10, 15, 20, 25, 30, based off of age and ideal weight or average weight of a kid, and how to run cardiac arrest and stuff like that. And he taught his toddler how to run a cardiac arrest, which was pretty cool. Super cool guy. He's a medical director out of Florida. So if you ever get a chance to look up some of his stuff, it's great to review pediatric stuff. Really good information. So Dr. Antevi, super smart fella.
Yeah.
Remember, these are tools when you're practicing medicine, not when you're taking the test.
True.
Yeah, because they'll get you in trouble while you're taking the test. We are big advocates in what I like to call cognitive unloading. And so if you have something like that at 2:00 in the morning and you're trying to get out of bed and you're like, frick, how much is a kid supposed to breathe? And then you pull out your little card. Cool. I get it. That's why we have protocol books. That's why we have medication guides and stuff like that. It's all tools we have in the ambulance because at 2:00 in the morning, if I need to try to calculate a sedation dose for an adult that's trying to beat the crap out of me, but I can't quite figure it out in my head, I can always pull a book open, flop it over, slap a couple pages to the side, and see it right there in my face. So don't be afraid to use that stuff while you're riding with us. Couple of really big things that I'm an advocate on when you're in the ambulance. I don't want to go over this since we're about to, since y'all are about to start riding with us. If we ask you to do something that you're not comfortable with, right? We're not going to ask you to go over there and start sticking patients full of narcotics. But if we say, hey, we might, I don't know, I might hand you a syringe full of narcotics. I'm just kidding. I know it's recorded. Just kidding. But if we do ask you to do something that's within your scope of practice that you haven't done before, you're not super comfy doing it, or you would like an explanation or, something like that, please let me know. We're not here to hurt people. We're not here to kill people. And I would have a lot more respect for you as an individual if you look at me and say, hey, man, I'm not super comfy with that. Do you mind helping me through this? Then look at me and be like, oh, yeah, I got that. And then you go over there and freaking yacht somebody's toe off, right? Please let me know, right? Another big thing that I'm an advocate of is treat these people with respect. that you would want somebody to show up to your family's house and treat you with, as long as you're riding with me, especially if you're riding with her. I can be a loose cannon sometimes. I'll admit that. If you start running your mouth at me, I'm probably going to do it back to you. She's not like that. If you're riding with her and you act like a dick, she's going to send you home. Period. Right? And so you're going to have to reconsider your life choices. When you get on the ambulance, we have logos everywhere. I have a logo on this. She has a logo on that. CJ has logos on his jackets, right?
We drive a giant billboard around town.
Giant billboard, right? So don't be doing anything that's going to get you in trouble. Don't do anything that's going to get us in trouble, right? I know people like to put on Facebook when we go sit somewhere and eat sometimes. They don't care if we do that, right? The county doesn't care. The county managers and everybody's like, yeah, I don't freaking care. Y'all go eat. Like, yeah, people are just like, oh no, the truck's been sitting here and they're stuffing their faces. Yeah, leave me alone. I'm trying to eat. I'm fat. So just don't do anything that's going to get y'all in trouble. Don't do anything that's going to get us in trouble. Be nice to these people. And my favorite words in the back of an ambulance is, I don't know. I say it. I can tell you firsthand, me and CJ one night, we had a young lady that I had dosed up with some ketamine for pain management. After I gave her her initial dose, my mind went blank. I could not for the life of me think how much more I could give her without sending her in the no-go zone and talking to the devil's advocates. I called her, right? I'm not afraid to make phone calls because if I don't know or if I'm on the fence about it, I'm going to make a phone call because I don't want to do something stupid that's going to end up looking like Colorado paramedics or that Iowa medic or, anything like that. If you don't know who they are, Google them. They're all over the internet. Both of them are looking at homicide charges. So don't do anything that's going to get us locked up. I like life. And don't do anything that's going to make us lose our jobs. I have a lot of child support, so I need to pay that. But my biggest pet peeve is telling me you don't know. So if I ask you a question and you don't know, I will respect it a lot more if you just say it out loud. I'm cool with it.
Yeah. One more addition that I am going to say, especially with riding with Chaz and I'm not 100% sure on everybody else that works with us. But for us specifically, if you come in and you're not like willing to learn or like kind of being upfront with your learning and coming to us and being like, hey, let's go over this and go over this. I'm not going to put a bunch of effort into like teaching you something if you don't have any affect that you want to be there. So go ahead and be proactive with your learning. Ask the questions. Don't be afraid to ask to review or ask to go over the sim man or ask to go over blood pressures, whatever it may be. Because if you walk in and you're just sitting there on your phone all day, I'm gonna let you sit on your phone all day. So that's who I am as a person.
Yep, I will help you as long as you're willing to help yourself. If you're not willing to help yourself, then there's nothing I can do for you, and you're going to sit there and stew in your own discomfort. Like I want you to succeed. I want you to do well, but you have to want to succeed and have to want to do well. On the flip side of that, if you run into issues on our side where you have a provider, this should not happen, but if you have a provider that's not helping you, that's not willing to, you're going up to them trying to ask questions, trying to get help, whatever that may be, and they're not doing those things, please come back to us and let us know because we will nip that in the butt real quick. We want y'all to learn. And so if you're not having a good experience on these ambulances, same thing. If we walk in the clinic and you're walking around the clinic and we walk off to go take a piss and, whoever you're walking around with starts acting like a dick, please let me know. I know everybody at that hospital. I know everybody in charge of that hospital. And I can sit down and we can have some conversations. So don't be afraid to speak up about that stuff either. If you have bad experiences, then you're probably not going to be the only one. And so we need to bite that in the butt before it becomes a problem. So.
All right. Questions. All right.
27th, Met cards are due. And I need your due dates or I need your ride dates. What days you want to ride. Remember, pick 5 days. Start in order 1 through 5 on your favorite day, the one that you want to see us the most. Has everybody applied for their provisional? Has anybody not gotten it back yet? I know you haven't. You haven't. Has anybody else? You haven't. Okay. You haven't either. Have you? When did you apply?
I still got to get a hold of my account's locked out.
Okay.
Oh,
It's
okay.
been a while, so I don't know who to email.
Okay,
Yeah.
that's
I
fine.
can
Well,
help you with that.
You know,
I had to do the same
I'll
thing.
bring it Saturday.
Well, write down your name and information because we have the
Yeah, she did
state
that
guy.
mine instantly, like, on the
They're actually
phone.
way more receptive to phone calls now. So
Oh,
if you can, do a phone call to the state office and whatever the number is on the website.
Okay.
If you can get hold of somebody, they should be able to reset that while you're on the phone with them. The password that they give you, a temporary password, will only last 24 hours, and then they'll lock your account down again.
So go
So
ahead
if
and
you
change
get a
my
resolution,
password.
you need to resolve that issue right away.
Okay.
Yeah. So once you get logged on or once they unlock your account, you need to immediately sign on to that and change the password. If you call them tomorrow and still don't get responses or anything out of anybody, call or text me and let me know. And we'll try to, call me and let me know. And